What is up, MedGirl Squad? It's future Dr. Rezi again. And if you don't know me, hi. My name is Arezame Uye, and I am the author and illustrator of a children's book called Girls for Medicine. That book right up there. And this book is meant to encourage kids, especially Black and brown girls, to consider careers in healthcare. Why? Because representation matters. I'm not going to belabor this any further. I would like to invite Dr. Derin.
Hello. Hi, kids. My name is Dr. Derin. I am a anesthesiology resident physician. Anesthesiology is a specialty in medicine. As a physician, I went through the long path towards medicine. So that means like going to medical school, and now I'm in something called residency, which is training in my specific field of anesthesiology. It's going really well so far.
Great. My first question is, what is one fun fact that you would like for us to know about you, Dr. Derin?
One of the fun facts is that I am Nigerian. Nigerian American. So I love learning about different cultures in general. So that is a fun fact about me, that I do really enjoy reading. It's one of my favorite hobbies. I recently also started collecting children's books just because they're so colorful and, great. So that's another hobby. And I really like working out. I like being physically active, getting out there and, being in the sun, hiking, moving my body. It's great.
That's so good. Thank you for sharing all of that. I'm collecting a lot of children's books too, because I just really like the pictures and stuff like that. They're just so pretty and so colorful. So I definitely relate to that fun fact. So I guess you kind of talked about what do you like to do for fun? Like you like to read and you also like to learn about other cultures, but there's something else that I think everyone should know that you also like to do.
Did I talk about the dancing part?
No, you didn't talk about the dancing part.
I love dancing. It is one of my favorite things to do. And when I was in college, I was part of a dance group, and that brought me so much joy in the midst of studying. It was a great stress relief, and it was just great to just dance to music that I love. And now that I'm working, I'm not part of a dance group, but I just love dancing in my free time. Just put on the music, blast it, and just move your body, and it's great.
I dance like a potato. I'm gonna be very frank. So I just respect those who are really, really good at dancing, because it's a lot of coordination, but it's really, nevertheless, just dance. Have fun. If the music is really moving you, you can't keep it in. You have to just let it out through dance. So thank you for sharing that. And I would love for them to see a move of yours, a few dances that you could do if you're willing, but that's completely up to you.
I don't have any specific dance moves in general. A little shimmy here, shimmy
No problem. What is your favorite food of all time?
Ooh, my favorite food of all time. The first thing that came to mind right away is Jollof Rice, which is a type of Nigerian food.
Mm-hmm.
It is spicy, it's red in color, and it's very flavorful. In general, I love rice, and having it be well seasoned is beautiful.
Whew, you said everything that I needed you to say to the people. If you have not had jollof rice, you need to tell your mama, you need to tell your dad, Mom, we need to go to an African restaurant, a Nigerian restaurant, and get something called jollof rice. Okay?
Mm-hmm.
Okay. As a kid, what did you want to be when you grew up?
As a very young kid, I wanted to be a lawyer. I would say that's serious profession that I thought I wanted to be. As a kid, I enjoyed talking a lot. I was like a parrot, you know, as a call, always talking. And I had some, you know, family members who were lawyers, and it was just a profession that I naturally just thought I would gravitate towards until I discovered medicine. But yeah.
Someone else, like, I think a previous interview, she was like, she wanted to be like a journalist, like a news person and stuff.
That's also one of the professions I had in my class too. I thought, you know, I mean, that might still happen, who knows? But like being on TV, like a TV personality, like Oprah, you know, I thought that was pretty cool as well.
In elementary school, what was your favorite class? And then what was your least favorite class?
Ooh, I would say I really liked like our English class.
Okay.
I liked reading as a kid, and even though I wasn't great at reading out loud, like I tended to like either stumble on my words or like or like mispronounce things. I enjoyed reading in general and writing, so that was probably I would say my favorite class.
So what was your least favorite class though?
There was a point where I enjoyed math, and then there was a point where I did not enjoy math. Sure, when the transition happened.
I kind of get that. Yeah. I think depending on like what topic in math we were learning about and stuff. Like, yeah, algebra, like I think algebra was pretty okay, but I think it's when we were going into geometry. Like,
I liked algebra. I think it was geometry for me as well.
I was just like, what is this?
We do quite a bit of math in anesthesia as well, or at least.
That's a really good segue. What made you want to be a physician? Even though in the beginning you were like, I want to be lawyer, or I could be like a journalist or a news person and stuff. So like, what made you want to become a physician?
I would say something that sparked my interest was actually my younger brother. I had a younger brother who passed away, and that experience sparked my interest in medicine. Just being like, you know, what happened? Why did he pass away? Could there have been anything that could have been done? You know, that sort of thing. So that sparked some interest in healthcare. And then I guess just some experiences with family members too as well, being sick. And then also even when I moved to the US too as well, not having health insurance also kind of sparked some interest in medicine as a whole. Health insurance, it's a way for people to be able to afford some of the things that you can get done at the hospital. So health insurance makes things cost-wise a little bit better. If you get sick, very expensive, and health insurance makes it more affordable.
And you said for you didn't have that?
I didn't have that. So kind of just being worried about not getting sick, and kind of like that also got me interested in medicine. You know, like, how do I stay healthy? How do I not worry about not having to be sick, so I don't have to like go to the hospital? I also had shadowed a little bit as well. I like worked as a volunteer at a local hospital, and that also got me interested in medicine. So I would say it's not just like one particular experience. It was like several.
More than one thing.
Yeah, more than one thing. As you get exposed to different things, you learn more, and that can either make you more interested or make you think, maybe this is not for me. For me, it would be like, oh, I kind of like this, or I think this might be more for me. So that's how it happened.
What made you want to become an anesthesiologist? So kids, physician and anesthesiologist, they are related in that physicians can go into different things called specialties. Dr. Derin is in a specialty called anesthesiology, and that's a big word, right? Dr. Derin, like, what made you want to become an anesthesiologist? What is anesthesiology anyway?
Yeah, so anesthesiology, which I know is a very long word.
Yep.
A type of doctor that does a couple of things. We mostly work in the operating room, but when someone is coming to have a surgery, you have your surgeon who's going to be the one operating, If you have like a broken leg, they'll fix that broken leg, or if it's a heart issue, they'll fix the heart. But while that surgery is going on, the anesthesiologist is the one that's gonna put the patient or the person getting the surgery to sleep so that the surgeons can do their thing. We make sure that while you're getting surgery, you're safe. That means that your heart is working okay, your breathing is okay, because we're helping to breathe for you. We're using a machine that helps you breathe while you're like completely asleep. We'll make sure that you're completely safe so that when you wake up fine, and your surgery is done and you're okay. We also do a couple of different things besides putting people to sleep. We deal a lot with pain management. So for some people, they have really, really bad pain from whatever things. It can be from like something with their nerves in their body, or it can be like they have some chronic pain issue. Even things like, patients like even sickle cell patients who, it's a type of disease, they have a lot of pain too. So we deal with all kinds of pain and helping people feel better from their pain. We also do different things, including helping women who are pregnant. We help with their pain as well, making sure they can deliver their baby safely. We also work with kids who are getting surgeries. We also do very critical things like working in the ICU, which is a part of the hospital that deals with very, very sick patients. So we do a lot of different things. We're mostly known for, being the ones that are in the surgeries and helping you,
go to sleep. We put you to sleep. Just to help you guys understand how that name even came to be. The thing that they use to help you that puts you to sleep is something called anesthesia. Okay. So anesthesia is the sleep medication that you're taking, and it's a very, very powerful sleep medication. So powerful that it's allowing doctors, specifically surgeons, to go and check inside your body to see what's going on and take out or fix whatever's making you not feel well. So for them to do that and for you not to feel it, that's when the anesthesiologist comes in. And that is so cool if you think about it. You don't feel them going into your tummy and all of that stuff because they're the ones that put you to sleep and they numb it out. So you don't even know what happened. So I really love that. It's really, really cool, Dr. Derin. And I'm sure a couple of girls might be hearing this and they might be like, oh, that's so cool. I want to be a physician.
Yeah.
I have that power. How do I get to that? I want to do it so bad. What do I have to do? So the next question I'm going to ask you, just to appease those girls, is what do you have to do to become a physician? And then what else you have to do to become specifically an anesthesiologist?
Okay. Yeah, for sure. So to get this superpower of being an anesthesiologist, you have to do a couple of different things. Obviously, one, finish high school, number one priority.
Yep.
After that, you go to college. College is 4 years. Then after 4 years of college, you can go to med school, or you can choose to work for a little bit. I worked for a little bit before going to medical school. Medical school is another 4 years. So that's 8 years so far. And then once you finish medical school, you are now a physician. You are a doctor.
Yep.
But you still need training in your specific field. And as an anesthesiologist, a gas doctor, my training is 4 years. So it ends up being 4 years of college, 4 years of medical school, and 4 years of residency, which is the training to be an anesthesiologist. And then once I'm done with that, I am officially an anesthesiologist and can do everything that relates to my specialty.
It definitely takes a while to become a physician, and it takes a little bit more time to become an anesthesiologist. But that's why it's so important for you to know that this is what you want to do, more than any other profession. How can a girl become a girl for medicine like you?
I would say one thing you definitely need to be able to do is work hard. If you can work hard, you can do this. That is it. It doesn't matter if, if you've had some, challenges, or you feel like you don't have certain things other people do. If you can work hard, you can certainly become a physician if that's what you want to do. It can be a long road, and it's not easy. I would say it's not easy, but if you're able to work hard, you can certainly do it. One other word I would say you would have to be is resilient. And being resilient means that you don't give up. You will face challenges. Things can be really hard, but not giving up is huge. And if you're not, if you don't give up, you can make it through the first 4 years of college, and the 4 years of medical school, and then the 4 years of, residency training to be an anesthesiologist. So those are really, those are two big things that I would say that you would have to become a physician. And then there's some other things that are also really important, for sure, and that's just being a caring person. I think in order to just make it in life, to be successful, you really do have to be a caring person about the people that you interact with in your school. And then because you, as a physician, you're someone that works with people. That is your job. And having a caring personality is important. If you go to the doctor, you want a doctor that cares about you and cares how you're feeling. So being that is very important as well.
I want to address all the girls out there that is watching this, and you look like me and Dr. Derin. Dr. Derin, what advice would you give to a little girl who looks like you and me, and she wants to be a girl for medicine too?
We need so many more physicians that look like us. We need so many more women in healthcare that look like us. Unfortunately, we're a very small amount. Only 2%. Only 2%.
Say it again. Say it again.
2%. That means 2 out of 100 people. If there were 100 doctors, only 2 out of the 100 doctors would be women that are physicians and that look like us. So that's a very small amount. And there are so many patients, so many people who are sick that look like us, that would love to have a doctor that looks like them as well. So we are needed. So I would love if, you are interested in being a doctor, certainly work hard, be resilient, be a caring person, know that you can do this, and know that you are absolutely needed. No doubt about it. And, there are so many ways to stay motivated. It can be certainly a hard road. I love the book, Girls for Medicine. I think it's great. It's a way to stay motivated as well, knowing that, people are doing it. And obviously, just in the age of social media, you can always see people who are also being successful. And that is also a motivation as well.
We definitely need you. We need you. And I'm just trying to show y'all that it's so much more than just loving science and being smart, but there's just so many other parts about you that it's going to be very, very, very helpful when you become, I said when, not if, when you become a healthcare professional, when you become a physician like me, like Dr. Derin, well, me in 3 years, I'm still a medical student, but Dr. Derin is officially there. You can officially be part of the amazing 2%, but hopefully it will grow and grow and grow and grow. So thank you so much, Dr. Derin, for sharing that. That was amazing. I really do appreciate you just reminding them what is at stake. But all the things about them that is so, so, so important in someone who wants to do something in healthcare. So thank you guys so much for watching this video. And I really do hope that you watch all the other videos that we have on this channel. If you would like to keep up with these kind of videos, all you got to do is make sure you like this video, subscribe, and turn on your notifications so that you will be the first to know when we have a brand new video up. And if you would like to follow us somewhere else beyond YouTube, sure, we have Instagram at Girls for Medicine. Make sure you follow that. And I also upload TikToks. still working on those. I don't think they're the best, but they're fun. I hope you enjoy those. But if you would like a copy of Girls for Medicine right up there, then you can just go to girlsformedicine.com and place your order there, and I will make sure to sign it to whoever that book is going to be for. And Dr. Derin, would you like to share where people can follow you on Instagram?
Sure. So I have an Instagram, and you can follow me there. I do oftentimes post some of the things that happen in my day or interesting things relating to anesthesiology or medicine or the journey to becoming a physician. My Instagram is exactly like my name. It's Dr. Derin, and that's Derin, and then it has an underscore at the end of it. So you can find me on there. I'm pretty active in social media. I think it's great to be able to see doctors who are living regular lives and doing what you can also do.
Feel free to let her know, hey, I watched this video on YouTube and stuff, and I'm so inspired. I'd like to know just any tips you'd like to give me. And I'm sure Dr. Derin would be more than happy to answer them when she has time to do that. MedGirl Squad!
MedGirl Squad!
I love it! Bye!